if staff could please call the roll. Or I have the names here. Is America there to call the roll, or I wasn't sure how that would go?
Yes, I am.
Thank you.
Amber Joyner.
Here.
Leanne McCauley.
Here.
Misty Von Allen.
Present.
Natalie Sanchez.
Here.
Alice Ledesma. Alice is here. Jim Nadeau.
I see Jim.
I see him, but I think he's muted. Darren Ballum.
I don't see Sheriff Balaam.
Okay. Charlene Bybee. I don't see her on there.
Do not see her.
Diane Nicolette.
Present.
Marcy Burke will not be here. Coretta Patterson.
Here. Hey, you might want to private chat to them, to Alice and Jim, since they're both here but didn't say here.
Okay, thank you. Jeffrey Frame. Scott Benton.
I'm here.
Richard J. No, I don't see him there either. And there is no student representative. That's it, Amber.
So Richard J. submitted his resignation to the committee, so Richard's not part of the group any longer.
Great, thank you. And regarding the student representative, the last student's term ended, is that correct? So do we have plans for getting a new student on?
We do. I reached out to Michelle Hammond, who's the consultant that sort of oversees that process, and Ben Hayes as well, the Chief Accountability Officer. So they are trying to help us find a student rep. They actually had found one right before COVID hit, but that person may no longer be able to join us. So hopefully next meeting we'll have one.
That's great to hear. I just want to make sure if there's anything we needed to do to initiate that process, let us know, but it sounds good. Thank you. Okay, moving on to agenda item 1.03. Was there any public comment submitted?
No, there was none.
Okay, thank you. Item 1.04, this is the action to adopt the agenda. You'll notice that there was not a copy of the March 2nd minutes in your packet, and so staff is requesting that we pull that from the agenda and move it to the next agenda. So besides that one change of removing the March 2nd minutes, are there any other changes that anyone would like to make? And if not, I'll accept a motion. I see Jim's hand is up.
I am here. I had everything on mute, so apologize for that. But I move to approve the agenda as amended.
Okay, do we have a second? And then we can have some discussion if there are any amendments to that. Second?
This is Misty. I'll second.
Thank you, Misty. Is there any proposals for amendments other than that one from anybody else before we take a vote? Okay, great. Seeing none then, all those in favor say aye.
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 All those opposed? Any abstentions? Okay, motion passes. And number 2, items for presentation, discussion, or possible action. Looks like item 2.01 is going to be Dr. Paula Marca, and that is an introduction of the Safe and Healthy Schools Commission members.
Hi, bear with me 1 second, please. I'm trying to pull up my form. So we have 2 new commission members that I'd like to introduce. There are several folks that also opted to continue their service to the commission, and thank you for that. But I did want to introduce first Natalie Sanchez. Natalie has, I know Natalie fairly well. She is an expert in mental health field. She has been a strong partner with the school district for several years. She has worked most recently with our school psychology department and our counseling department, co-locating some services for families and students within certain buildings. So Natalie, would you introduce yourself to us?
Thank you guys for having me today. I'm so excited to be a part of this commission and hope I can be helpful in some way. As Dr. LaMarca said, my name is Natalie Sanchez. I'm a marriage and family therapist. I've been in this community practicing for the last 14 years. Love working with kids, adolescents, teachers, staff, really anybody at the school district it's been a great partnership, and really passionate about mental health in this community. So again, thanks for having me.
Welcome aboard, Natalie.
Thank you, Natalie. So I would also like to introduce another strong partner of ours, Dr. Lorraine Benuto. She's with the University of Nevada, Reno, and like Natalie, she has worked with us to co-locate some psychological services in some of our schools. So Dr. Benuto, could you introduce yourself to the committee, please?
Yes, thank you so much. I'm very excited to be part of the committee, and like Natalie, hope I can be of assistance. I've been in the Reno area for about 17 years providing services. A lot of my work is culturally specific, so I work a lot with the Latinx population, and I look forward to working with everyone.
Welcome
Welcome.
aboard. Good to have you.
Thank you.
Welcome.
That's it.
Okay,
for
great.
me.
Thank you.
Thank you.
Thank you to everyone who's returning to this work, and also welcome to our new members. That's wonderful. Okay, moving on to item 2.02, discussion and possible action to select a committee chair for this coming year. And under this item, I wanted to make sure that we had time to discuss ahead of time. I think sometimes when we go through this process, we aren't even sure like who's interested in being these positions before we all nominate a person, and then that person has to be voted up or down. And so I definitely wanted this to be a discussion. To start it off, I wanted to just acknowledge the great loss of our chair for over 5 years, the founding chair of this organization that really, was the inspiration for making it happen, and I think led us incredibly well for those 5 years, and that's Lisa Ruggiero. And I spoke with her recently, and she said she's available to help transition the next chair, and definitely, her heart is still with us. As you may know, I just want to congratulate her. She got a dream job at the VA, which is something she'd been working towards with her master's degree in social work finished. And so we can't be anything but happy for her, but definitely will miss her. So whoever is the next chair has big shoes to fill, but you still have people who are there to help and support you. As vice chair, I'm acting chair today. I'm running the meeting. I'll definitely be there to help whoever's the chair. During this discussion, though, I just wanted to say that I can't have my hat in the ring for chair, so I'd like to withdraw my name from any possible nomination. I'm just being realistic. I wouldn't be a great chair right now. I have a lot on my plate, and I think somebody else would be a better leader at this time for this group. But I'll be here helping in any way I can. So with that being said, I'd like to open the discussion to anybody else who is interested in being the chair. You'll see later in the agenda, we have anyone interested in being vice chair. We can talk about that later too. And also we can talk about what the role of the chair might be coming up. I mean, I think we've had a little bit of a hiatus with the COVID situation, but now coming back, we'll want to do probably another planning session and set our goals again and figure out where we fit in with this whole COVID situation. And so I think that there's a great chance for sort of reinventing with our new group what goals and priorities we want to have, what work we really want to do, but then also being sure to continue the good work that's being done with the audits and other things. So any discussion? I'm open to anybody who's interested in the role. Please do speak up. Don't think that it's, don't be shy. Don't think that it's being, immodest in any way. We want to know if you're interested in helping lead. Yes, Mr. Benton.
So I wanted to throw my name out there. I know that maybe before I do that, I want to ask Misty if she would be accepting of a nomination of a chair. I think the role that you play in the community is a big one, and I think that could tie a lot of the resources to the work that we're doing. And I just want you to know, Misty, I admire the work that you do and think that you have the willpower to lead us in the direction that we need to go. So if you're accepting of a nomination, I would like to go that route. But I did tell Amber that I would like to throw my name out there for vice chair.
Scott, I really appreciate the kind. Oh, sorry, Madam Chair, may I speak? Not
Please
used
go
to
ahead.
this format.
Please go ahead.
Thank you so much, Scott, for the kind words. And I want to first say, Amber, you were my idea for nomination until your words just now. So please know you've been an incredible leader. I appreciate the nomination, Scott, but like Amber, I feel I don't have the strongest voice to lead. I would be more than willing to be vice chair and support someone. I think the shoes that Chair Ruggiero shared with her incredible creativity and ideas is something we need in a chair. But I appreciate that, Scott. I would support your name.
Thank you. Other discussion? Are there other folks who are interested in chairing this committee, this commission?
I'm not interested. Now's not a good time. I think there's a conflict of interest running for school board, yada, yada. But I want to contribute to your second question, and that is really what the role is. And I think that both Misty and Scott would contribute greatly in those in those positions. I think it's really important to recognize that being that conduit, that communicator between the commission, the administration, also a role in the community. If we continue, and I hope we do, the audit, that's a huge component. So I think you asked a really good question, Amber, is what exactly is the role? Because we know that Lisa made so many things happen silently. And so you have to recognize that, if I had to guess, you guys help me, she probably, depending on the week, maybe put in sometimes 5 to 10 hours a week being chair, depending on what's going on. So, you want to consider, that time frame too. Just my 2 cents on part of the role.
Great, thank you.
Amber?
Yes, Ms. Patterson.
Question is, when would the term end? Timelines are so weird now.
Right, thank you. So this is to finish, my understanding, and staff can correct me, but I believe this is to finish the term that started this summer in July, and so it would just go through next summer. With, of course, the potential for being re-elected chair, but I think it would end officially next summer. Is that correct?
June 30th, 2021.
Okay. Thank you.
I think Mr. Nadeau may have had his hand up earlier.
Thank you. Go ahead.
Madam Chair, I'd support both Scott and Misty for that position.
Okay, thank you.
I guess the question is, would Scott and Misty be willing to serve as co-chair? And is that allowable?
That's a good legal question. I mean, if we were able to elect co-chairs and then maybe not have a vice chair, would that be against our bylaws?
Well, we prefer chair and a chair and then a vice chair. What you could do is if the chair wants to work with the vice chair and delegate duties and the vice chair is willing to accept those, that's appropriate. So it's a little cleaner to have chair and vice chair because one of the duties is to help create the agenda, and ultimately staff needs to have a point person to work with on how to create that agenda.
Okay, thank you. Great, other discussion?
Madam Chair?
Yes.
I'd move that Scott Benton be, I nominate Scott Benton for chair committee or commission and Mr. Vaughn as vice chair.
Okay, thank you. I think we need to separate those motions since the vice chair is a different agenda item, right? Let's just make that really clean. So let's talk about chair right now. And I will accept your motion in a moment. I just want to make sure that everybody got a chance to talk if they wanted to. If we could just put it on pause for a second. Thank you, though. I appreciate so much you making that motion. Let me just make sure, was there anyone else who wanted to add to the discussion before we take a nomination? Okay, great. Then thank you. We have a first, we have a motion. Do we have a second?
Second.
Thank you, Dr. Nicolette. Any other discussion? Okay, seeing none, all those in favor say aye.
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 Any opposed? Any abstentions? Okay, seeing none, congratulations, Chair Benton.
Thank you very much.
Thank you.
Wonderful.
Thank you for throwing. Yeah.
Thank you
We
very
have
much.
our first meeting tomorrow morning at 7. No, I'm kidding. We don't.
Okay, and so Chair Benton, if you'd like to take over the meeting at this point, that would be appropriate.
Awesome. Thank you, Amber. And I just want you to know I appreciate you and your leadership. It's not gone unnoticed that you have been a great leader, just as Lisa has.
Thank you. Thank you.
So looking at the agenda, we have agenda item 2.3, which is possible selection of a vice chair for 2020 to 2021 committee year. So I guess I'll open it up to discussion. We had some great discussion on our last action item, but if there's any other discussion, if not, a motion would be appropriate.
Mr. Chair?
Yes, sir. Go for it.
Misty Von Allen be nominated as the vice chair.
I'm looking for a second.
Diane Nicolette, second that.
Thank you. Any discussion before we take action on this? All right. Seeing that we have a motion and a second, all those in favor say aye.
Aye.
Any opposed? All right, Misty, welcome. I look forward to working with you. I think it could be very easily shared between the two of us. Next item is been pulled from the agenda, so we're going to go to 2.5. Yes, sir.
Let me interrupt real quick. Just to remind all the commissioners, if you can, to please unmute your mics when you vote. We're getting only 2 or 3 people. But just so everyone knows, if we only hear the voice of 2 or 3 people and there's no nays, it's presumed to be unanimous anyway. But it would be a cleaner record if we could all unmute our mics and participate that way. Thanks, everyone.
Thank you. Item 2.5 is presentation from the Washoe County School District Office of General Counsel on Nevada Open Meeting Law, requirements for public bodies. I'm going to turn it back over to Neil for his presentation.
Great. Thank you, Chair. Chairman Benton. Good afternoon, everyone, and thanks for being here, and thanks for serving on the Safe and Healthy Schools Commission. We really appreciate it, and all of you play a really important role. And on behalf of the board and the superintendent, we can't thank our volunteers enough for all that you do for us and the guidance that you give us in these important decisions. So today we're going to just go through the basics of the open meeting law. For those of you who are new, or those of you who have not heard of the open meeting law, or wonder what I'm doing at your meetings, it's mostly for open meeting law purposes, is to make sure that we're in compliance with the open meeting law. So we'll just do a quick run through. I provided a copy of this memorandum that I'm holding up, which is dated, I believe that you've received the September 14th one. It's from our office to all public bodies. So does everyone have a copy of that or received a copy of that? Okay, great. So we're just going to run through that, and I'll provide some information. If you have any questions at any time, please feel free to interrupt me, ask anything that you may have. What we tried to do when we created this memo was create a primer for members who serve on public bodies, so that you didn't have to learn everything in the open meeting law, because a lot of it is not things that you'll be doing. Your staff's doing it for you behind your back. So Dr. Lamarca does a lot. Ms. Gillespie will do a lot. She's your new clerk, such as creating minutes and those type of things. Posting agendas. For example, the law requires certain things, if you will, certain locations be used when we post agendas. That's something that you'll never do. So what we try to do, instead of teaching you things that you don't care about or need to know, we try to make it more succinct for actual committee members. So we hope you found that this memo was useful, and we'll just go through it. One of the things, though, if you do have any questions, you're welcome to work through Dr. Lamarca, and he'll work with me to answer your questions. Or you can go to the Nevada Attorney General's website, which has a link to the Open Meeting Law Manual. It is my understanding that Attorney General Ford has updated it. So this site on this memo may be old. I believe it just came out last week, his new version. So quickly, just keep in mind that a public body cannot hold a meeting without a quorum. So a quorum is 51% or more. So if you have 11 members on a public body, you must have 6 members to conduct a meeting. A lot of times members of the public will show up and they'll want to make public comments, but there might be only, let's say, 5 members. It's our advice that you don't allow public comment. You can't have a meeting at all by law. And if you do open a meeting and you are less than a quorum, it could create serial communication issues down the road. So unfortunately, if the public does show up, and you can't make public and you can't start a meeting, it does waste their time. So we strongly ask that if you can't make a meeting, to let staff know, because if we know we're not going to have a quorum, then we'll cancel the meeting to not waste the public's time. So keep that in mind, that you always have to have a quorum to run a meeting. And then if you have a quorum, if you have, let's say, 11 folks on your committee and 6 showed up, then to carry an item, you only need 51%. So 4 people out of 11 could actually take action on an item if you've met your minimum quorum requirements. So it's important that we get as much participation as possible from all of you. We understand that at times it's not possible to make every single meeting, but if you can make it, we sure appreciate having you there. As I said, the board really relies on your input. The board has a tendency to always defer to advisory committees such as yourself. And so it would be great to have all of you there as much as possible. And then turning over to page 2, I think I already covered an action. An action is just a majority of the members in attendance for your purposes. There's actually a little nuance in the law that if you were all elected public bodies, such as the Board of Trustees, it would require 50% of the entire makeup of the board. You don't need to worry about that. If you want to talk about it later, feel free to, and I can bore you right to tears. Give me a call and we can talk about why that is. So the next thing is that you have to remember that all meetings that you have are subject to the open meeting law. They must be done in open, and you have no reason to close a meeting. There are special provisions that would apply to the Board of Trustees to close a meeting, but I don't ever see this committee having to go into closed session. So we won't talk about that. But some things that you do need to remember for every public meeting that we have is that you must have a public comment period. As you've seen, we've had a public comment period at the beginning of this meeting, a general public comment period. We at the school district actually exceed what's required of the open meeting law. So we do a general public comment period at the beginning. We allow folks, members of the public, to comment during each action item, and actually even non-action items. Oftentimes we'll let folks talk. And then we also do a general public comment period at the end. So that's actually in excess of what the open meeting law requires, but it's a nice way to have a meeting because it allows members of the public to come in and give some general comments about what you might want to talk about in the future. Then it allows them to give you specific comments on the specific item that you would be considering. And then again, at the end, more general comments. So it creates a nice flow, and we've found that's been pretty effective over the last 5 years. The other thing that's created for every single board meeting is public body meeting, commission meeting, is a clear and complete agenda. And that's what the law requires, clear and complete. So Every agenda in the Washington County School District is read by somebody in the legal department. I read most of them. I'm your legal counsel, so I read yours. And it must clearly say that the item is for possible action. And this is one area where you can help me out, because at times we forget this. You cannot take action if it doesn't say for possible action. And an action is not only just a vote like we took earlier in item 2.01 and 2.02 of this agenda, or excuse me, 2.02 and 2.03 of this agenda, where we all said aye or nay. A vote can be acquiescence. It could be all of you agreeing to do something without actually having a motion. So we really need to be careful about going off of our agenda items, and we also need to be careful about going off of our agenda items, and even worse, taking action. The open meeting law is very clear. You can't take action on an item unless it specifically says you're going to. So the example of that might be a presentation such as this, and you might start having a conversation about this presentation and decide that you want a legal opinion from our office regarding a certain subject matter, and you decide to take action to ask for that legal opinion. That would be a violation of the open meeting law, because that's not what's on the agenda. What's on the agenda is me presenting to you about the open meeting law, not you taking action to request an opinion from us. So keep that in mind. That's one area where you could really help us out. When you attend a meeting, you can see on your agenda what is for action and what's not for action. And just be careful to keep your conversations to the agenda topic and to not start requesting things of staff. We can always put that on a future agenda. I'm not suggesting you can't do that. What I am saying, though, is that we can't do it unless it says you're going to take action. So I hope that makes sense. It's kind of weird presenting this way, so I'm just going to look for nods, and I'm going to presume if you're not nodding that you're either good to go or asleep, one or the other. I hope not sleeping. So, all right. And then the only other thing that we have on the agenda is the accommodations for folks who need accommodations, and we handle all of that for you as staff. So don't worry about that. I think the biggest pitfall to watch for is electronic communications, and that's on page 2, number 5. Be very, very careful with your electronic communications. Texting is probably the easiest way now to inadvertently violate the open meeting law. For example, Misty might text Diane, who then might text Natalie, who might text, I'm just going to use your first names, I hope that's okay. Misty texts Diane, Diane texts Natalie, Natalie texts Amber, Amber texts Scott, Scott texts Coretta, etc. Next thing you know, what are we doing? We're holding a meeting without being in public, and we're probably deciding something 9 times out of 10 if we're texting like that. You can ask the folks in Lyon County about this. They have a case right on point where the Lyon County commissioners made a decision using their phones, and they did it over text, and the Nevada Supreme Court said that that was a violation of the open meeting law. It happened probably about 2 years ago now, maybe a little over 2 years ago. We've always thought that in this office, and we've advised for the last 5 years that you have to be careful with your phone. The other easy way to do it is email. So whenever you get an email from me or Dr. LaMarca or Superintendent McNeil or any staff member, you will always see that we BCC, we blind carbon copy the entire commission, because what we want to avoid is the reply all button. Because it's okay for us to send something to you so that you can look at it to educate your decision on an action item. But what happens is Scott inadvertently, sorry, Mr. Chairman, but I'm going to blame you. Scott inadvertently hits reply all and says, I think this is the worst idea I've ever heard. Well, guess what he just did? He just created a meeting, and he's now telling all of you what he thinks, and he started deliberations. Deliberations under the open meeting law must be an open. So that's why we always BCC. So if he hits reply all, he's only going to be communicating with the staff members who sent it to him. So just another thing to think about in your communications, that the electronic use of electronics is dangerous. Now, there is an intent requirement in the open meeting law, and the intent is that you intended to do a meeting using electronic means. I don't want to go down that road. Let's just not do it so we don't have to argue it out with the AG's office or go to court or anything like that. Let's play it safe. I am always willing to help you avoid those situations, and so is our staff. And Dr. Lamarca works on quite a few public bodies. He's excellent. Ms. Session knows this stuff. Ms. Gillespie works in our office, so we're all here. I'm not going to say Dr. McNeil, she knows it too, but we don't want to bother her. She's got enough on her plate. So if you need help, let us know and we will help you avoid these issues, okay? So I think those are the big things to watch for. I can't stress enough, stick to the agenda, stick to the agenda, stick to the agenda. I really have enjoyed over my past working with this commission. And the great thing about this commission is you have some smart folks with a lot of great ideas. However, there's always that however coming, right? However, you have to be careful to not make your own idea become a subject of discussion, deliberation, and those type of things, because it's probably not on the agenda, and that's probably a violation of the open meeting law. And I have always believed that the lawyer for a public body is like a good referee at a sporting event. You really shouldn't know who he or she is. So I try to stay out of your meetings and let you go, but we have to avoid going into subjects that aren't on the agenda. And I'll work with Scott, the chair, to stop folks. And if we stop you, please don't take that as we're being rude or we're upset. It's just we have to follow these rules. And the reason for the rule is that the public, the average person walking on the street, is entitled to know what you're going to do. You're spending his or her tax dollars. And so they get to know what you're going to consider. And that seems only fair. And that's really the purpose of the open meeting law. The last thing I want to mention is I strongly suggest, if you are using a private email or an email for your work, to not do that. I strongly suggest that you create a free email account, either through Yahoo or Gmail or Hotmail or any of those other services that provide them for free, that only deals with the business of the Safe and Healthy Schools Commission. I recommend that because if litigation were to arise, and I don't really see that happening with this committee, but you never know, or if a public records request came in for the records of this committee, you don't want me digging through your private email to try to find emails only related to Safe and Healthy Schools Commission. And you really don't want the court doing that. I think we can all agree on that, because what will happen is the court will probably go into chambers and ask to see the emails and ask to see the account, and they'll flip through to make sure that we've provided what needs to be provided. So no one wants their private emails being subject to the public, and that's reasonable. So we strongly recommend that you create by way of example, Amber might create ambershsc@gmail.com, right? So that's her Safe and Healthy Schools Commission account. So those are some ideas on how to move forward with the issues that'll pop up for you as part of this commission. We again thank you, and if you haven't, we really do. It's very important to listen to our community, and this is just one more great way that the district does it. So, are there any questions? Was that pretty clear? Clear as mud? Okay, Diane gives me the clap. I'll take it. All right, thank you, everyone. I appreciate it.
Thank you, Neil. Moving on to the next item on our agenda is item 2.6, which is a presentation and discussion of the Washoe County School District reopening activities for the 2021 school year related to safety and security of students, staff, and visitors. This is for information and discussion only. It looks like I'm turning it over to Dr. Lamarca.
Chairman Benton, may I share screen?
Of course.
Okay. Are you seeing a PowerPoint presentation? Okay, good.
Yes,
Actually, I'm going to turn it over to Dr. McNeil to get us started. I think Dr. McNeil is going to walk us through our initial principles.
Thank you very much, Dr. Lamarca, and thank you very much, Safe and Healthy Schools Commission and Commissioners. For the record, Krista McNeil, Superintendent of the Washoe County School District. So both Paul and myself have given this presentation to various stakeholder groups, including our own Board of Trustees earlier this school year. Tomorrow afternoon at our Board of Trustees meeting, we're actually doing a very in-depth report on lessons learned so far, 7 weeks into the school year, if you can believe it. And if you feel so inclined, tomorrow afternoon at 4 o'clock at Reed High School, that's going to be an in-person board meeting, as you all know, but it's going to be live streamed as well. And it's we only have 2 other presentations tomorrow. And so this is the last of the presentations on our agenda for tomorrow. But for this one, we wanted to just kind of give you a real high level look as far as what it means to reopen our schools. And I go back to very much in the spring and summer. And we had a task force that was put together with teachers and principals and community members, leadership team members. And we really talked around what was important within the reopening of our schools. And that's where the guiding principles, as far as a foundation of do no harm. So if you remember last year when our schools went into closure, one of the big items of concern was grading and how were we going to grade students when we really weren't sophisticated at that point in time on distance learning, right? It was very new to us as teachers and principals, families. And so we really wanted to make sure that students were not harmed in any type of grading policies. Well, coming into this year, one of our big foundations was on attendance. And so we've been reviewing consistently our attendance policy. And so that's an example of an area where we mean do no harm. We also want to make sure that our students, our families, and our staff, their basic needs are being met, whether that's personal protective equipment, whether that is food security, just making sure that those basic needs are met for our family and our staff. And then equitable access. Obviously, this is a huge concern when we're talking about the digital divide and devices and connectivity, not just the actual device itself, but internet and connectivity and how we're going to be able to do that. And then maintaining high academic expectations. We had a very robust meeting today with our academic leadership team around finals. And if you can believe it, those are coming up in just a few weeks in December. And so talking about how are we going to be doing student finals and grading and those types of expectations for our students. And then finally, following all federal, state, and local health and related guidelines, and whether that's an executive order from the governor's office, whether that's through the Washoe County Health District, but making sure that we're following all of those health protocols.
So thank you, Dr. McNeil. And please, I know it's kind of clunky with Zoom, but if people have questions as we go, don't hesitate. I'm also intending to go pretty quickly through this because it's a high level overview and it's covering a lot of ground. We could get into any of it with questions more deeply. So as Dr. McNeil mentioned, as one of the guidelines, we followed what the federal government was asking us to do, the state. NIAA stands for the Nevada Interscholastic Athletics Association. We followed some of their guidance as it relates to student athletics and activities. And then of course, county guidance. We work with the Washoe County Health District virtually daily. I feel like I'm actually working with them multiple times per day these days. Centers for Disease Control, obviously, they're the nation's expert in this area. And we have followed their guidelines. The governor, as I'm sure you all know, has issued several directives. We have followed all those directives. For example, with respect to social distancing, initially it was 6 feet distance for all students, all adults at all times. that was reduced to 3 feet at the elementary level at a particular stage. We have chose to try and maintain 6 feet at all times, but that's an example of changing guidance. Governor has issued several directives which have changed regarding face masks. So there, initially he was requiring face masks, but there were not a broad set, but there were more exceptions than exist now. Occupancy, the rules for a period of time were no more than 50 people in one location, and it had to be below 50% occupancy. That was just recently changed, and now you can have a group as long as you can maintain certain measures of up to 250 people in a space. We're choosing right now to err on the side of caution at every possible turn. The NIAA guidance really has impacted families, and it's impacted our students greatly. We have limited athletics. We've limited activity within the schools significantly out of caution. We will begin sports, and there may be changes. It's a hot topic, but we will have a winter sports season starting in January that will be followed by a fall season. So football will come after basketball, which is a winter sport, and then we will have spring sports. Those will be condensed schedules, and practice and conditioning will also be a little bit more condensed than we would like. So as soon as the pandemic hit, Dr. McNeil spearheaded our COVID-19 task force, and that quickly splintered off into 4 sort of general areas. There were discussions of distance learning, employee concerns, food security, and climate. And really climate, the focus within climate was around mental wellness, social emotional health. The distance learning group, they worked on materials, communication technology, and Dr. McNeil already talked about sort of where we were at that point in time. It was a very difficult time. It seems so far ago and almost like yesterday, all at the same time. But if you recall, initially the governor had basically had a shelter in place only till the end of March. So we didn't know if we would be back in school just after March. Then it was at the end of April. And then finally at the end of April, a decision was made to go for the entire school year. So this really affected our ability to deliver strong distance learning options for students, especially since all of us were in kind of a state of not panic, but certainly heightened anxiety, fear, worried about our family and our safety health-wise. Once we knew that we were going to be remaining on distance learning for the end of the 2020 school year, and then we had to start thinking about this school year, we splintered off. The distance learning group became the teaching and learning group, and that's really been split into 2 areas: elementary education, secondary education. Of course, right at the end, I'm talking April, May now, there's a focus around summer school. But Dr. McNeil also had us start a reopening task force. This was a very eclectic group. I think we still meet. There's somewhere around 70 members. It includes a lot of site-based folks, principals, teachers, also a lot of central office folks, but a lot of partners as well, folks from the business community, a lot of partners with Renown, partners at UNR, partners in the private sector. And that group is at this point, we are sort of monitoring what's occurring, but that group was instrumental in looking at personal protective equipment, our self-screeners, a lot of discussion. These were subgroups, these boxes off to the right of reopening task force. A lot of focus on vulnerable groups and what's best for a vulnerable group. Is distance learning better? Is in-person learning better? And it may depend on the particular type of vulnerable group. We looked at types of models, learning models that we might be able to consider as a school district. And then I can't really see it on my screen. Oh, I just skipped forward. I'm going to skip forward. These next couple of slides, we just put these in here to let you know that prior to going to the Board of Trustees, which we really began in earnest in terms of reopening on June 9th, and we've been with them every 2 weeks since, sometimes till 1 a.m. It's been a lot of very deep discussion around how we return to school and keep students and staff safe in that process. But we did do, this was one of our first, we've done several, but surveys of families. I think, as you see here, we got 36,000 families that responded to the survey, which is an enormous response rate, far more than we typically get. And this is held fairly true. About a third of our families, even back in early July, were suggesting that they would opt for distance learning, and that's kind of held at this point. We're at about a third on distance and 2/3 in our buildings. We likewise, we did surveys with staff to get a sense of their comfort level. Our human resources department they've done a Herculean effort, and at times, you know, it feels like we should be doing more, but they have done so much. They've worked with all employees that either needed or felt they needed accommodations in order to work, and on an individual basis, everything has been done to make that possible when appropriate. So you get some of this, I'm sure you all are aware of at this point, but it's worth talking about. At the elementary level, so after many discussions with the Board of Trustees, the board acted at the elementary level to have what we call in-person learning. So this is essentially the opportunity for every elementary age child to be in school Monday through Friday within a brick and mortar classroom. In order to do that, we had to adhere to what were the governor's phase 2 reopening requirements. We still do all of this. So we developed through the reopening task force a self-screener that we expect all staff members, all students, all families to use on a daily basis, where they're essentially checking their symptoms, including whether or not they have a fever. We use social distancing. Our schools are filled with visual cues, kind of helping students know, you know, how far apart they should be, which direction they should walk, those sorts of things. Face masks are required of everyone, except for with medical exceptions. We do, you know, when it's safe, when it's possible, provide an opportunity to remove that face mask. I don't know about you guys. It's very difficult for me when we're in meetings in person and you got to wear that face mask. It's hard to hear. It gets hot. And our kids have been amazing. There was a lot of concern initially that kids would not follow some of these rules. My office, one of the great things we get to do is deal with behavioral issues that we experience in schools. We've had maybe 2 referrals to our office regarding kids not following the measures that are in place because of COVID. Of course, at the elementary level, while we want in-person learning or providing that, every family had the option to do full distance learning. At the middle school and high school levels, the board opted to use hybrid learning. And really what this is just essentially half the time you're at school and half the time you're not. We use an A/B method. So on this particular week, we're in, you know, hopefully the smoke doesn't come in and change our plans, but we're in for 5 days. Let's say it's an A week. That means the A group comes in on Monday, Wednesday, Friday. And on Tuesday, Thursday, they still are in school, but they access school remotely. And then the B group comes in on Tuesday, Thursday, and then on Monday, Wednesday, Friday, they access school remotely. And then the following week, that switches, and B would be Monday, Wednesday, Friday, and A would be Tuesday, Thursday. So with hybrid, just like with in-person, all those phase 2 requirements must be in place. And then while the kids are working on distance, then all the distance rules are in place. And again, all families have the option to have full distance learning as opposed to coming into the buildings. So with distance learning, there are a variety of options. We have our North Star Academy that does provide support for students K-12. That school, I think, traditionally has had, I'm gonna guess a little bit. I don't have numbers in front of me, but somewhere around 180 students. This year, it's just over 800. So we've had a lot of families that have opted to work with North Star. Ingenuity is a secondary program. This is available to middle school and high school students. This is what we would call more of a, it's a program that kids have traditionally used to recover credits. If they have failed a course and they still need to take a full load, but they take an extra course to make that up, they could do it with Ingenuity. Or students who are trying to accelerate and maybe get to graduation earlier. It's actually quite a rigorous program. It's what we would call asynchronous as opposed to synchronous, meaning by and large, students who are working on Ingenuity work independently. There are still attendance rules. There is still availability for tutoring, things such as that. And then at the elementary level, we also have, and at the high school level, we have our online curriculum planning guides. Essentially, we're able to deliver some distance education through Microsoft Teams. I want to touch on this a little bit, and please, Dr. McNeil, correct me or chime in. You know, initially, distance learning in our district, as we've already mentioned, was in response to crisis. Now it's a reality, and I think it's a reality that there may be some silver linings, that this is a viable option for delivering instruction. It has been, but one that might be used more in the future. You know, initially with crisis response, it was a check-in opportunity. We did not provide new learning. We reinforced the learning that had already occurred. And that was largely because of inequitable access. We knew we were going to have families that did not have devices, that did not have internet connection, that didn't have transportation, and their ability to access new learning was going to be hampered relative to some of their peers. We did provide paper pencil materials, worksheets, lessons, units, and we did that in a variety of ways. We did provide it digitally. But we also had our transportation staff was tremendous. They would deliver using safety guidelines. They'd deliver paper materials all over our community. We would designate times during the day where people could pick it up. We'd deliver other things at that time as well, like food. So again, we focused on review. We didn't teach really new concepts. It was a flexible daily requirement in terms of attendance. We minimized grading. Attendance was essentially taken weekly, and we didn't have any of the assessments like finals that you would traditionally see at the end of last year. Now we've really flipped that on its head this year. We still have some equity challenges that we are trying to overcome, but this year's distance learning program it's standards-based, it's new learning. We are trying, we had a discussion today at a meeting Dr. McNeil referenced about there was a need at some schools to address some of that gap that occurred at the end of last year before you could get on to some of the newer learning. But this year is standards-based. It's technology integrated with paper materials. As I mentioned, we're delivering in a variety of formats, but technology is key. We need kids to have laptops and internet connections, and we're working feverishly to make sure that that is always the case. We're grading, attendance is taken daily, and we are using some assessments. So many operational implications. I'm going to go through this very quickly, but we have lots of families that rely on transportation. Our buses are operating at about 50% capacity. We load from the back. Kids have assigned seats. They have to wear face masks. We have windows down to the extent that we can to make sure that we've got good ventilation. Nutrition services. I got to say, Pete Charge Group, our intervention department, partnered with the food bank and other community partners. We've been feeding families for a long time now, and it's one of the best things I think we've done as a district is just making sure that our families' basic needs are being met. You can't get to learning if your safety needs and your physiological needs and your psychological needs are not being met. So kudos to Pete Etchart and the food bank and everybody. We continue to do that. Our meal options in schools are more limited than they were previously because of some of the safety measures. For example, we would have like a buffet tray in the past. Well, you can't have buffets at this point. So we also can't have large groups of kids in like the lunchroom. So sometimes we have schools where kids are eating within the classroom during the day. Individually wrapped meals are provided. When kids are on hybrid or our kids who are on distance, if they need meals, if they were on free and reduced lunch, they had access to that. Now with the new change with the federal government, all meals are available to all students at this point in time. We try to provide those, especially like on smoke days or other times at the school sites or other locations in the community, so families have relatively easy access. We know some families have harder time with transportation than others, and we're trying to work with them as best we can. Technology, big divide for us in our community. Our technology office and operations, again, have worked tremendously hard, ensuring everyone's got internet connectivity. We've got mobile units where we're going out in the community providing internet. We've got hotspot devices that we're providing for any kid that needs a hotspot device. And then actual laptops. We've issued many, many laptops. I was told today that we still have approximately 1,600 kids that need laptops. And our schools are doing everything they can to provide loaners. Knock on wood, we feel everyone will have a device by the end of the year. That has created some difficulty for some families at this point, but we're doing everything we can to support them with technology. So this is just again, very high level, our multi sort of layered safety and health approach. Everybody self-screens on a daily basis. We physically distance, we wear face coverings. We have sanitizer everywhere. We encourage hand washing at the schools. The kids, they are taking several points of the day in order to wash hands and doing that in a safe way. And it becomes a challenge for teachers to manage all that while they're also trying to deliver instruction. We have disinfectant everywhere. We have enhanced our cleaning activities on a nightly basis, and we are paying attention to ventilation. We actually have very good ventilation in our buildings, at least based on standards. This is just an example page. We have an outbreak response plan. If you go to our website, and I can send that out if the commission is interested in it, we have a reopening task force webpage. It's filled with resources, including our outbreak response plan. This is a page taken from that. That was really developed by the Washoe County Health District, but in collaboration with our student health division. And it applies to COVID-19, but it really applies to all infectious diseases and what we do when. So when we quarantine a student because of close contact, or when a student is asked to isolate due to symptoms, it's been a trying time. I think our employees district-wide have never worked harder in their lives. It's a little hard because everyone is sort of working in the urgent. And it's very difficult at this point, like it is for us always, but it's very difficult for us at this point, to do the intermediate planning and the longer term planning and working towards those efforts that are critical as well. We're all kind of stuck in the urgent. This last couple of slides, I'm just going to touch on, we are providing data at our Washoe County School District website. We update it 3 times a week. It really has 3 sets of data. The top set, we highlight information from the TMRPA risk meter. That's another group that we've been associated with. Mayor Sheedy had sort of a regional COVID task force or committee. And in the last couple of months, Washoe County School District has participated. Our board is using that risk meter as one of the indicators it uses. We look at average daily cases, test positivity is defined by the governor. The middle section is community-wide rates of infection at different age groups. And then at the bottom, we provide some school-specific information. Those 2 sections will not be, they're not one-to-one because we have more kids, for example, community-wide in the 5 to 10 age group than we have that are in Washoe County schools. We're doing very good in our schools. We have had many schools that have had incidents of COVID. Several have had more than 1 incident. But by and large, we've done incredibly well. And it's because of the staff, it's because of the students adhering to those rigorous safety precautions. This is just a picture of the risk meter from the Truckee Meadows Regional Planning Agency. It's updated daily. And then you've probably all seen this. This is another dashboard from our Washoe County Health District. The Health District has been tremendous. They work with us, like I said earlier, every day. They provide us special data downloads several times a week. They're a great partner. That was a lot and very fast, and so I can answer any, or I can try to answer any questions you may have, or we can move on.
Misty, did you have a question?
No, thank you so much, Paul. That was very thorough. I think I'll save my thoughts for a little later.
Go for it, Jim.
Dr. Lamarca, thank you again for the presentation. My question is, the school district has tried to implement so many security things prior to COVID. How is this interlocking with, how's he addressing the security of COVID with the other security issues, such as, so many of the things? Are those kind of being set timeline back a little bit because there's such an emphasis on COVID?
I'll respond, and then maybe Dr. McNeil will want to respond as well. I would say no. If anything, they've actually enhanced some of that. So, for example, single point of entry. We still have single point of entry. I think some of the lobby guard stuff has been, we're not using that. I don't think in all locations, but in most cases without an appointment, unfortunately, parents don't come into the building at this point. As students come in, they have to come in a very orderly fashion with distance between them. So, knock on wood, of course, things have been very safe so far. We did, because of COVID and because of significant hits to our budget, we have had to put several contracts on hold at this point, which includes the contract with I'm going to forget their name, but the group that was doing the
Safety Advisory Council. Yeah.
Right, the group that was doing the assessments with us. We do expect to continue to do those assessments when we're able to get that contract underway. I know that Chief Trevino was able to hire a second person in emergency operations. He's being trained on some of the assessments. So I don't think we've had to hold off on too much.
Yeah, and I'll just quickly follow up. So for example, Jim, we had, if you remember, with the last legislative session, school police officers now had to wear body cameras. So over the fall break, our school police officers tested out. We had 8 officers that tested out the cameras, and then coming away, starting today, those all of our police officers will now have the body cameras. So we're moving forward with different types of safety practices. Paul had mentioned earlier around athletics. Starting today, we're also doing extracurricular activities. So that would be activities, you know, debate, yay, yeah, clubs, at least one time a week for right now, depending if you're A or B. But that's something social emotional that we thought was really important to get back. Playground equipment, even though in the elementaries we're not at that point yet where we're opening up the play structures because of supervision and social distancing. It's very difficult to do social distancing when you're a little one on those play structures. But we will have playground equipment, PE, balls, and those types of things. And I mentioned that, and Misty knows this, because that has a direct correlation to the health and well-being of students, which has a direct correlation to safety and security and our schools on a whole, on how students are doing. So
Let me add to that. We have, you may recall in the last 2 meetings that the commission met, we talked about the conference that we were about to launch on trauma-informed practice. That had to be postponed, but that is going to be rescheduled for the spring. We haven't determined yet whether it'll be digital or in person, likely digital at this point. Also, all of our contracts with mental health providers for psychological services, all of those have been signed. So we are providing some critical mental health support services to students and to families as well. That has not stalled.
And Dr. McNeil, if you'd like me to expand on this, the school safety surveys, I'd be more than happy to do so.
absolutely. I wasn't quite sure if Misty wanted to have a question or.
And Diane had one as well, so I'll defer to Diane.
Are you sure, Misty?
Go for it.
Okay, they're rather quick, and they're kind of a mixture of that social, emotional, and physical well-being. Very quickly, on the safe and healthy screening and exclusions diagram, clinical aides and nurses. Is there a clinical aide and or a nurse present in each school, each facility?
Yes.
Or are they, yeah, okay.
Clinical aides are allocated for every building, and then we also have nurses. Our nurses typically serve more than one school.
Yes. Okay, thank you. That's really good to know. Kind of moving to the, I'm gonna move to the devices. Just a clarification on year. You said 1,600 students still need devices. They should have them by the end of the year. Do you mean the school year or the fiscal or the calendar year?
I apologize if I said end of the year. What I meant was end of October of
Ooh.
2020. Yes, and actually, I believe that includes many kids who actually, they have a loaner now, but they will receive a device. So there are some kids that probably still don't have devices out there. We're working daily with schools to try to assess who has needs. I will mention that we also prioritize that. So our students out living in transition, homeless, or living with foster care, some of our other vulnerable populations, they receive devices first.
And seniors, and that comes into play, Diane. Seniors last year going into spring, we made sure that our seniors had high priority because that's obviously credit bearing and you know, graduation. So seniors had priority going into the closure last year for device.
I have a question about accessing devices or hotspot internet. Is there like a fact sheet where one can learn about how to direct students to those resources? Just as a mental health provider, we've had a couple of cases where we've had students not know how to access those resources, and of course I'm certain the schools have provided that information, but for whatever reason, the parents didn't get it or didn't understand it. And I'm just wondering if there's a fact sheet that maybe us as mental health providers might have to help coach the parent on how to access those resources.
Do we get that one, Paul? Or?
Well, I can try. I think actually thank you for the question, Dr. Benuto. It's a very, I don't know that we've been providing our mental health partners with some of these fact sheets. And so I will work with staff to see if we can do that. Certainly at our website, there's a lot of information available, but if you lack the device or the internet connection, you're gonna have a hard time getting to our website. We have been providing what we're calling fast webinars. We've been supporting families throughout the year around technology. We're actually doing some kind of cool things. We're hopefully going to have an event at the El Rancho Drive-In Theater where we have on, like a movie, we have on screen basically technology 101. We've done it at a couple buildings so far, but we're hoping we can work with El Rancho and maybe have that be more community-wide. But let me talk with Delisa Crane. You know Delisa, she's the director of our Family School Partnerships group, and I'll talk with a couple of other folks as well and see if there's anything that we can get out there. It may exist and I just may not know about it.
Okay, thank you. I really appreciate that.
And there was a large, Lorraine, there was a large push, there still is a very large push with the governor's task force on broadband. And this came out of a need across the state for connectivity. And so myself and our chief IT officer have sat on that committee, and they have done a tremendous job on getting supports, not only for the two largest districts, Clark County and Washoe, but importantly the rurals too, to make sure that those students had broadband. And last time I checked, I want to say it was now up to 12 or 13 of the districts are what they call green. And that means every child has a device and is connected.
That's awesome.
Thank you. You both answered my question because I have a passion for our new faculty, which are parents and families, and I'm really glad to hear. I will share that information about how you're supporting families, because that's really important. It's a question I receive a lot.
All right, Misty, it's your turn.
Great. Thank you, Chair Benton, and thank you, Superintendent McNeil. I just wanted to commend you all. I've been a part of your task forces in and out with wellness, and thank you for including me and how you've been able to bring your hybrid model to this community and families, meeting them where they're at. I think it's been tremendous because I'm watching other districts who aren't there yet, and we get worried about the isolation and that challenge of risks. And it's getting to be shifting towards that mental health and isolation risk. So I'm really appreciative of all you've done. And just everyone be on the lookout for how we do this better with technology. We don't have those answers when it comes to social media issues and access to lethal means. We aren't getting that message across to families. So it's a really lethal combination for those that might be at home being educated alone. And not necessarily your district, but just wanted to bring that up. Thank you so much.
I appreciate that, Misty. You know, every week I'm on a call with the Council of Great City Schools, and these are some of the largest urban districts across the country. And it's been really interesting because there is nobody that has this down as far as, you know, the perfect model. And all of us are struggling, and we're very transparent about that. Nobody, you know, there's nobody that's gone through a global pandemic before, and to flip the entire model of public education, which has been set in its ways, right, for, you know, a couple of centuries now, and yet now we're shifting. So a lot of lessons learned, and I think that presentation tomorrow is going to be really unique and very, very out there, as far as these are things that we're still learning about. We don't have all the answers, you know, so thank you for that.
Are there any other questions, comments? Okay, I'll go ahead and close this item by thanking both Dr. Lamarca and Dr. McNeil. One thing I noticed in the presentation was the change in the wording from crisis response versus distance learning. We all thought distance learning back in March to June was what we were going to expect this year. So I think the designation of the crisis response, because it was truly a response to the crisis. Now we ironed out those kinks and now we're actually providing distance learning. So I appreciate the verbiage so that the parent in me can understand really what's going on. And then secondly, I really appreciate the conversations that are being had about social emotional learning. I think that is important to move forward with that. I don't think we ever expected this pandemic, so we don't know how it's going to impact our kids later in life, let alone right now. So I appreciate that conversation being happening and continuing to happen.
Absolutely. And believe me, we're still ironing. We're still ironing.
Big thing to iron. So thank you, Dr. Lamarca, for the presentation. Dr. McNeil, thank you for your portion. We're going to move to item 2.7, which is a presentation and discussion from Washoe County School District Office of General Counsel on changes to federal Title IX requirements and state bullying legislation and reporting. This is for information and discussion only, and it looks like we have Gina with us for the presentation. So Ms. Session, it's yours.
Thank you very much, Chairman Benton. Congratulations. And I'm very happy to be here this afternoon. I just thought it might be instructive. It feels like forever ago that we were last all together. And I'm pretty sure it was at the last all together meeting that we discussed making a switch with the bullying oversight. As you all probably recall, we have a resolution agreement with the Office of Civil Rights. And as part of that resolution agreement, we're required to have a task force. And you all graciously agreed to be the task force for our bullying and harassment program. And specifically what the language in the resolution is about, because it's a little vague about exactly what that oversight is going to look like. And I think I'm hoping, Chairman Benson, that we can work together to come up with a format that's valuable to the committee going forward. But basically the language from the agreement is that the task force is to make recommendations for improving school climate, implementing intervention and prevention strategies for preventing harassment, and ensuring that students and parents understand the right to be protected from harassment and retaliation, and how to report incidents of bullying, harassment, and retaliation. So for today's purposes, I thought what I would do is just give you a little overview of what I've been working on in collaboration with other members of the Office of the General Counsel. And to begin with, one of the issues that we work to resolve, we get complaints of staff on student bullying, which we handle through our administrative investigator in the office. We kind of have a centralized process for handling staff on student matters. There was a concern that that it was taking some time to complete those investigations. And so we worked on a project to come up with a investigation form and tool that the investigator can use that's kind of a simplified process. As you'll recall, our bullying law requires that we complete bullying investigations in 2 school days. And so we weren't doing that, but we're hoping with this new tool that we've developed that we will be able to complete those in a much more timely fashion and within the requirements of the law. A kind of extra bonus with those, that new investigation form is that it's something that our administrators at our school sites will also be able to use for bullying investigations to make sure that they're covering all their bases and doing all the things that they need to do. Starting at the end of October, I'll be doing some mandatory training with school administrators. So I do two different courses. I do an introductory course for people that are new to conducting bullying investigations, and that's a 2-hour course. And then I do a refresher course for those veterans that have been through a few school years with me working on bullying investigations. And so we're going to be doing those as mandatory trainings again, starting at the end of the month. Generally speaking, our reporting numbers on Safe Voice, obviously when we were in distance learning, those numbers dropped off pretty dramatically. And we still get occasionally some cyberbullying kind of issues that come up. And also, it's been my experience at the beginning of school years that it starts off slow. And so we don't have a great deal of Safe Voice reports coming in at this time. So that is the bullying, sort of the bullying state law part of my report. I'd also like to update you on Title IX. I don't know if you're all aware, but there's been some very dramatic changes in Title IX over the past several months. In May, the Department of Education issued new regulations that are, there's 30 pages of regulation and like 2,050 pages of explanation of the regulations, all dealing with, it's Title IX, but it's very specific to sexual harassment and how districts and institutes of higher education are required, what they're required to do in response to sexual harassment complaints. And so those were issued in May, and because we didn't have enough work dealing with COVID, they decided that they would be implemented August 14th, 2020. So they're in effect. And we've been I've been working on a change to our policy, a regulation that just sets out the procedures that we have to follow. So the regulation and then specific procedures for the role, the roles that we have to have in the district. So part of this new process is that we have to have 3 primary roles. We have to have a Title IX coordinator, which is me. We have to have a Title IX investigator, which again is going to be our Amanda Gormley, our district investigator. And then thirdly, we have to have a separate person that has to be different from those 2 people that is a decision maker on these cases. And so Paul and his group kindly have offered to provide support on that, because we think it's really important that this process being so involved, that it's better that we handle it in a centralized fashion, and as opposed to trying to train administrators in 100 schools on the process. So that is the work that we're doing. That will also obviously be part of the training that I'm going to be offering. And also, we've been doing coaches training. That's my other, and we'll be starting coaches training up again. We kind of finished everybody off. I think we trained something like 750 coaches, which is like most of all of the coaches in the district this last school year. And we'll be starting that up again in December. I think that's everything, and I'm happy to answer questions, any questions you might have.
Any questions? No? All right, Gina, thank you for the presentation. I appreciate the hard work that you do.
Thank you, Scott.
All right, with that, we're going to move on to item number 3, which is closing items. 3.1 is public comment. So I'll ask the recording secretary if there is any names or anybody who has submitted public comment. None?
Sorry about that, Chairman. Chairman Benton, there are no public comments at this time.
Thank you very much. And I saw a hand raised, Mr. Nate.
Mr. Chairman, there wasn't an agenda item, so I thought I'd just make this comment under public comment. Parking was so easy today. It was amazing.
Yes, it was. Thank you very much. Item 3.2 is our next meeting announcement, which is Monday, November 2nd. 2 p.m. is our normal meeting time, and I assume we'll be meeting at the Zoom fashion as well.
Think so.
All right, I'm showing that it's 3:28, so we will call this meeting as adjourned. Thank you, everyone, for your time.
Well done, Chair Benton. Pretty good for your first second out there.
Thank you.